Hi everyone, today in this video let us discuss about Desloratidine. Desloratidine is one of the antihistamine. It is the second generation antihistamine, or it is also called as non-sedative antihistamine. That means this medication shows less sedation as it does not enter into the brain. It mainly shows the peripheral actions and it acts as selective H1 receptor blocker. Desloratidine is one of the long-acting antihistamine, therefore it can block the histamine actions for a longer period and it can be given once daily. This medication can be given to treat seasonal allergic rhinitis. It is one of the allergic response that is airborne that can produce few of the cold-like symptoms. It can produce sneezing, runny nose and nasal itching. Nasal congestion can also be observed leading to stuffy nose. Itchy and watery eyes are also observed, and in severe conditions it can also produce red color of the eyes. People may also have fatigue, sore throat that results in the difficulty swallowing, headache and facial pain can also be observed. This seasonal allergic response is mainly produced by the pollen grains which are released from the weeds, grasses and trees. Since these pollen grains are available in a specific season, this type of allergic rhinitis is called seasonal allergic rhinitis. These pollens can act as allergens and they can induce an inflammatory response. When there is an inflammation, histamine is more released from the mast cells and basophils. This degranulation of histamine can produce various types of allergic response. Histamine can produce vasodilation in the blood vessels that increases the capillary permeability, leading to swelling. It can also increase the sensory perception that results in the increased itching and pain response. In this way, seasonal allergic rhinitis results in the release of histamine from the mast cells and basophils, which produces allergic response. Now, Desloratidine is a long-acting antihistamine that can be used to control these symptoms by blocking H1 receptors. It only acts on the peripheral histamine H1 receptors with no sedative actions. Second clinical use of Desloratidine is in the treatment of perennial allergic rhinitis. This condition can persist throughout the year and again it involves the similar symptoms like stuffy nose, sneezing and runny nose. It can also produce nasal itching, watery eyes, and even it can produce itchy skin and itchy throat. Fatigue may be developed due to that sleep disturbances. This type of allergic response is mainly due to exposure to few of the allergic substances like dust mites or the allergens coming from the animals and fungal molds. In a few people, few of the irritants like cigarette smoke or pollutants can also produce allergic rhinitis. Again, in this condition, histamine plays an important role where it can increase the itching response, inflammation. This allergic response is mainly associated with inflammation of nasal passages. So here, histamine plays an important role in induction of inflammation, vasodilation and itching response. Here again, Desloratidine is highly useful by blocking the histamine actions and reducing the inflammation. Third clinical use of Desloratidine is in the treatment of chronic idiopathic urticaria. It is also commonly known as chronic hives. It is a skin condition that is characterized by itchy skin with red wheals or bumps on the skin. These hives may persist up to 6 weeks. So spontaneously they can be developed and they may be disappeared, and they are idiopathic in nature. That means the underlying reason is unknown. However, they can produce itchy and red skin. If it is untreated in a few people, it can also lead to angioedema that results in the swelling of lips, eyelids and throat. Particularly, this urticaria can be produced due to autoimmune response. That means the host immunity is going to be inappropriately activated that results in the allergic and inflammatory response. Again, this condition involves the release of histamine which produces inflammation and itching. That's why Desloratidine can also be used to control chronic idiopathic urticaria. Now let us see how this medication works. Allergens can act like antigens and they can trigger an immune response. Particularly, they can produce a degranulation of mast cells and basophils. This results in the increased release of histamine, which produces allergic response. Histamine plays an important role in the induction of allergy. All the allergic actions of histamine are mediated through the histamine H1 receptors. These H1 receptors are G protein coupled receptors that are associated with the phospholipase C system. Therefore, when histamine acts on the H1 receptors, this phospholipase C is activated. That results in the release of two important secondary messengers, inositol triphosphate and diacylglycerol. Both of these mediators can increase the intracellular calcium levels, which mainly results in the few of the cellular responses like contraction of the smooth muscles and increased release of further inflammatory mediators. H1 receptors are located mainly on the smooth muscles, endothelial cells and immune cells. However, histamine can act on different way on the vascular endothelial cells. When the H1 receptors are activated on the vascular endothelial cells, they can stimulate the production and release of another mediator, nitric oxide. This nitric oxide can act as a potent vasodilator. It can produce a relaxation of the vascular smooth muscles, leading to vasodilation. Along with vasodilation, it can also increase the vascular permeability. Therefore, histamine can produce swelling as well as inflammation. This vasodilation produced by histamine can produce a wheal and flare like response on the skin. Now, desloratidine selectively blocks these H1 receptors, thereby it inhibits all the allergic actions of histamine. Therefore, desloratidine can reduce the inflammation, itching response as well as vasodilation. And this medication is a long-acting H1 receptor blocker and it only acts on the peripheral H1 receptors. That means without any central action, it mainly blocks the allergic response produced by histamine. Now let us see the precautions of this medication. Desloratidine is metabolized in the liver and it is going to be converted into its metabolite 3-hydroxydesloratidine. However, this metabolism may be variable in a few people due to difference in their rate of metabolism. Few of the individuals may act like slow metabolizers, so they will have less metabolism of desloratidine. Therefore, with the frequent administration of this medication, it is going to be more accumulated in the body, leading to increased severity of the side effects. That's why in people with significant side effects, either dose or dosing frequency may be modified due to improper metabolism of this medication in the body. Even though desloratidine is not producing the sedation and it is not reaching into the brain, but still it should be carefully given with the other sedatives and even with alcohol. In presence of alcohol and other sedatives, desloratidine may increase the sedative effect. The metabolism of desloratidine can also be influenced by a few of the other medications, particularly azole antifungals like ketoconazole, macrolides like erythromycin and azithromycin can inhibit the metabolism of desloratidine. This results in the increased plasma concentrations of this medication. However, it may not be associated with significant systemic effects. Therefore, when these medications are given with desloratidine, care should be taken to monitor any unexpected side effects produced by this medication. Similar effect can also be observed with the cimetidine. Cimetidine is a histamine H2 receptor antagonist that is particularly used to control gastric acid secretion. It also inhibits the metabolism of desloratidine, leading to increased levels of this medication in the body. Desloratidine is a long-acting antihistamine and it has a half-life of 27 hours. It can show its onset of action within 1 hour, and due to its long half-life, the duration of action is around 24 hours. It is mainly metabolized in the liver and excreted in the urine as well as feces. Therefore, in people with any liver or hepatic impairment, this medication should be carefully used. Now let us see the side effects of this medication. Most of the side effects of desloratidine are peripheral and well tolerated. It can produce headache, irritability and fever. In a few people, it can also produce the diarrhea, dizziness, somnolence and fatigue can also be observed. At very high doses, it can produce epistaxis that results in nasal bleeding. Few people may have hypersensitive reactions like rashes, itching, and difficulty breathing. In case of serious hypersensitive reactions, this medication should be discontinued. Rarely, this medication can also produce palpitations and tachycardia. With use of desloratidine, appetite may be increased. Now let us see the dosage of this medication. Desloratidine is available as tablets at a strength of 5 mg. Even it is available as oral disintegrating tablets at 2 strengths such as 2.5 mg and 5 mg. For the treatment of allergic rhinitis and urticaria, it can be given at a dose of 5 mg once a day. It can be taken either with or without food. Food has no significant effect on absorption of this medication. This medication can also be given in the children. For treating seasonal allergic rhinitis, it can be given in children with age above 2 years. For perennial allergic rhinitis, it can be given for the children with age above 6 months. In the children, the dose depends on their age. In the children with 6 to 11 years of age, 2.5 mg of desloratidine is given per day. It can be given as oral disintegrating tablets or oral solution. The dose is further reduced in the children with age less than 5 years. What is desloratidine? Desloratidine is a second generation long-acting peripheral histamine H1 receptor blocker. How this medication works? Desloratidine blocks the H1 receptors selectively that inhibits the actions of histamine by reducing the activation of IP3 and diacylglycerol system. This results in the reduced itching and pain sensation. It also reduces vasodilation by inhibiting histamine-mediated nitric oxide release. This reduces swelling and inflammation. What is the important precaution of desloratidine? In a few people, desloratidine can produce hypersensitive reactions resulting in rashes, itching, and difficulty breathing. In such cases, this medication should be avoided. What is a common side effect of this medication? Desloratidine can produce few side effects like headache, dizziness, dry mouth, somnolence, and fatigue. So that's all about this medication, desloratidine. I hope this video is useful to you. If you really like this video, please subscribe to our channel and share this video with your friends. Post your comments in the comment box. Thanks for watching. See you in the next video.